We piloted a test project for teledetailing in the Irish pharmaceutical market about 3 years ago. It was the first time it had been done for a conventional prescription pharmaceutical medicine, so we really didn't know what to expect. But we had become aware of this as an emerging channel, and we were quite keen to experiment and see if it was able to produce any upside for us. So after a lot of planning and deliberation, we put together a plan, and we very carefully had a lot of discussion about which product could potentially work or which couldn't work, and eventually we opted for a product called Relpax as a test case. So Relpax is a medicine which is indicated for the treatment of migraine. Quick capsule review, Relpax has been around for a few years, never heavily promoted, facing some very tough competition, and those competing products had always been quite heavily promoted, so very high levels of awareness. People out there talking about them, advertising campaigns supporting them, and Relpax never was able to compete in that space. So we thought, because there was such little noise around that, it would be the ideal candidate to test with this new model, because we had a very good baseline to go on. Nice steady sales, steady performance, and no incremental investments or any other supplementary activity anywhere else. So we knew that if we could demonstrate the success of a project with any product, it would be with Relpax, and that's why we decided to go with that. So it's fair to say, when we look at the results of the project, I think we really didn't know what to expect, because it really hadn't been done anywhere before, at least not with a product of this type of profile, a conventional pharmaceutical product. So we didn't know how many people would agree to be included in the process. We didn't know whether they would perceive it with any added value, or whether they would just think it was an annoying part of their day, or what impact it might have on the bottom line. But thankfully, because I think of the preparation that had gone into it and the fact that there had been so little activity before that, the results were really fantastic. So of the 600 or so doctors that we had targeted as part of this campaign, over 90% agreed to be involved right throughout the 6-month pilot project. And some of the other early indicators we had were very, very encouraging. So again, something in the region of about 88 to 90% said after the first contact they were happy to continue to be involved. And then something in the region of about 27, 28% had agreed that they would now start prescribing Relpax with their migraine patients where they hadn't before. So that was really, really encouraging. But of course, one of the main outcomes for the business was, what's the impact on the bottom line performance of the product? And we saw a very clear and sustained performance of an incremental sales growth of 29% over those 6 months of the pilot phase. So compare that to a very steady sales base where there was very little fluctuation before, it was a very, very encouraging outcome for us. So, I've seen at a global level, what's happened since we did Relpax. We've seen lots of other examples actually in the Irish market, but also on a much wider global level as well. So for example, since we concluded the Relpax project, we put a couple of other products into that model. We did that for a number of months as well. It's fair and accurate to say that the results varied for those products because we were doing experimental runs. So we kind of knew that we wouldn't get, the same heavy result for Relpax as we did for the others, but we were still looking at double-digit sales growth for products that were nowhere near that without the model, okay? On a wider global level, Pfizer as a company is seeing lots and lots of more interest, not just interest, but translated to activity as well, across lots of different regions and many markets around the world in those regions. So for example, in terms of the sheer number of markets that have been actively engaged with teledetailing, for example in 2013 over 2012, we saw more than a doubling of those markets that were never doing teledetailing, now doing some level of teledetailing. And that was 9 months ago. We've seen it grow even since then. So I would expect this to be a continuously growing MCM channel option. One of many, but definitely an emerging option for many markets around the world. The success of teledetailing could be down to a couple of different factors, I would say. So it's possible that, yes, there's, it's not a noisy market and not lots of other companies are doing this, and yes, to an extent I think we stand out as a company that's doing something where others aren't. However, it's no coincidence that in those markets and those countries where we see Pfizer now beginning to emerge and beginning to do things that we weren't doing before, other companies are following suit and doing the same thing. So I think, yes, it's a clear differentiator. There still isn't a huge amount of competition out there. So, there's not too many companies, and I would say customers and the market in general haven't yet reached that kind of saturation point where there's just too much coming in. But that's one piece. The other piece, I think, is very much focused on the offering itself and what that offering constitutes. So whether it's just a whole bunch of product messages that people don't, engage in very heavily, or whether it's something more than that, I think that really helps to drive success more than the competitive landscape. So, for example, you shouldn't really go out just talking about the product. You should go out talking about other things that the healthcare professional is interested in. So demonstrate value-added services or value-added items of whatever nature in a space and on a topic that is meaningful and relevant to the healthcare professional. So whether it's continuous professional development, whether it's access to educational, non-promotional information, whether it's access to information that is widely available already and simply saves them a lot of time and effort and energy to go off and find themselves, that's up to you. That's where the mix and the kind of magic touch comes in. But it's in that space of doing something over and above just the product piece. I think that's what makes the difference.